All right, guys, this is another live look at Invisalign scans. I should say iTero scans. This is a patient that perhaps would need some Invisalign, but let's go through everything. There's a lot to see in this particular scan. Let's start with our Occlusal Gram. The Occlusal Gram here is showing some heavy bite in here, in here, in here. Those are big old teeth, so that's not the most notable thing. But what do we have here? We got big heavy contact right here on this tooth, and this tooth shouldn't have that kind of contact. And what do we see here? We got problems here. And so gums have gone away here. We've got bone loss here. We've got a lot of tartar here. Huge issues that are going on. Huge amount of tartar in through here. These are the things we can kind of see and tell and start to put together the puzzle that is your teeth. We see also that the teeth are not perfectly aligned. Let's see if we can center this a little bit. That's not like that. Come back here and go straight across, and let's get rid of that one. And you can see that these teeth are way up above the level, the table, we would call that an occlusal table of the molars. We don't like that. We kind of like everything to be on one plane. It makes everything work together. And when we look at the top, we're going to see matched issues. So see, this tooth is all pushed out this way. Big red hits here. Big red hits on this one. It's not necessarily the way we want to set up a bite. Big spaces here. Let's come here again. Let's choose this one and come over here and look at this top. The way the teeth come together is also hugely important, and we got a missing tooth in here. So there's a lot of things that we can go over. Clearly, this person needs major help and maybe even some surgical help down in this area here with the tartar and the bone loss and the gum loss. They're probably going to need eventually an implant. We need to close the spaces. We need to come in here. Let's click off this Occlusal Gram so you can kind of see a little bit better. And let's go to this one. So it's nice and big. You can see that this tooth is rotated big time. It's out of this rainbow that we like to have here. This tooth is turned. So an implant or bridge in here. Looks like the rest of the teeth are doing kind of fantastic. It's not a lot of bad things happening on the rest of the teeth. So this is really just a functional problem. Seems like the person's brushing their teeth and trying to do their best, but we're just falling down here with whatever's going on in here and everything level. When these teeth become level and aligned, we're not going to have many problems with this mouth going forward. So there's a little sneak peek at what we can see in a digital scan.